Hello, everyone. My name is Dr. Erica Steele. I'm a board certified naturopathic doctor. I hold a lot of letters. You can look that up somewhere else. If you're interested, you can look below, actually. And so, really, today I wanted to talk about why primary care doctors really can't be holistic doctors. So, I guess it would be important to go over my background. So, I do hold 6 degrees in the natural healthcare space. AS in psychology, bachelor's in natural healthcare sciences, bachelor's in alternative medicine, doctorate in natural medicine, doctorate in naturopathy, master's in public health, newly done master's in business. But that's a 7th degree. And so, I have a lot of education in a lot of different areas, right? And so there's a reason for that. And so we'll talk about it. But first, if you're interested in holistic healthcare, all things holistic practice, public health policy, just really being educated about your health and why it matters and what you need to do, definitely hit that subscribe button. I'd love to, join together with you and teach you more. All right. So why primary cares just really cannot be holistic providers. And I know that people are craving for holistic providers. I see it all the time. People, they put their Facebook post out, or they'll put, tweets out, or, they'll inbox me, hey, do you know somebody in? And so there's a definite need for holistic providers all over the nation and really all over the world. And so I think it's natural for consumers to, kind of grasp for whatever they can and almost like makeshift, especially when patients across the globe are being failed by our healthcare system in one way or the other, either with wait times, limited access, high cost, restricted access. I mean, you name it. There are so many different concerns that are very valid that we have in healthcare today. And so I think to the patient as the consumer who is concerned about their health, but maybe they're not as educated about the world of natural health care or the education and that, again, the systemic, which we'll talk about. And so they're seeking out a different option. And so they think, well, if I find this kind of makeshift provider, maybe that will work. And so I just want to, go into why primary care simply cannot be holistic providers, no matter how much you want them to. And I'm sure the comments will be like, but mine is, and I will explain why it's really not plausible. So let's first jump into really the scope of primary care in general, right? So your primary care is that entry point into the healthcare system. They are pretty much your home base when it comes to anything related to your health. And so you would go to them usually for your annual, you'd get your labs done. A lot of times with women, they'll use their GYNs as their primaries, and that will, kind of work in that fashion. And so if there is something going on, your primary is then going to either treat that issue directly, or they're going to refer you to a specialist. So, and depending on, what type of background or education that particular primary care has, maybe they have family medicine, maybe it's internal medicine, maybe they're a nurse practitioner, whichever. I did family practice and I still do family practice for a long time, even though I'm a holistic provider. So the primary care is really in the primary care system. They're really only restricted to what is allowed under, their licensure, their certification. So anything that is considered evidence-based or considered part of, the conventional system. So you're not going to really get a lot of variation outside of. Now, and we'll talk a little bit more systemic. I know certain providers will, use supplements and things like that, or do additional testing, and that may be perceived as holistic, but we'll kind of talk about that in a minute. So when we're working with or excuse me, when primary carers are working in that system, there's a lot of limitations. It's heavy pharmaceutical focused. They're also at the mercy of, let's say, their administrator or whoever owns the practice. There can be a lot of wait times, getting in to see somebody. Also, too, there's a lot of turnover. So maybe you'll see one primary care this go round and maybe another one, so they can be very cyclic. Primary care is a really kind of hard profession to be in. I'll be honest with you, just because the long hours, the time, and the pay. A lot of times providers want to go more for specializations, and so where they can generate more, and so there's a lot of limitations within that system. And so being restricted to the actual system obviously is going to tie their hands, even if they have, more, let's say, holistic or natural leanings themselves. Really that system is going to say no, because if something happens, and there, I know a lot of people think that just because it's natural, it's healthy, and it can't harm you. And that cannot be further from the truth. Just because something is natural does not mean it cannot harm you. You still have to have a level of understanding and education and training in what you are ingesting in your body, because it can literally be a poison for you, or it can be a miracle. It's all about dosing. It's all about prioritization. There's all kinds of different factors, in terms of there's never one thing. There's never one miracle cure, and so it drives me bonkers. And people are like, oh, what do you think about this miracle, blah, blah, or this miracle? There's no miracles. The body has a system of healing, a system of finding itself balance, a system of disease. It has these systems in place. And so us trying to magic our way out of it, or us trying to colonize our body, is not going to work. So okay, so the primary care, just the system, I'm sure you can see, just has a lot of limitations, not to mention the fact that there's really no cultural education, right? And so holistic providers bring this stuff. So, me as a holistic provider, number one, I didn't just become a holistic provider. It really developed over time. That's why I have all of those degrees and all of that education. And there's lots of certifications in that. But really what makes me a holistic doctor is that I practice these things with my family growing up. So these are not practices that are things that I had to learn or go to school for. Yes, I did go to school for them, but many of these were very much a part of my, very early. I started running around labs and sitting in organic chemistry classes with my mom at 5, right? So getting all that, through osmosis, all that scientific understanding. So that's why you get a heavy scientific, mindset, but without all of the scrutiny and pain that the term evidence-based really has. That term alone was really used to, distinguish, say, no, this is science, and science, unfortunately, has been used and still continues to be used as a weapon against Indigenous and especially Afro-Indigenous practices, which now more than ever our world needs. And so, but we don't need it from a colonized perspective. That's when treating as a holistic provider, it doesn't work in the conventional structure. Trust me, I've tried. It does not. And it also doesn't work in the conventional sense that you would think it does, meaning that you can't apply the same principles as the current failing system to a holistic practice, because it just won't work. So holistic providers, if they are truly holistic providers, have a deep connection to their work. They have a deep spiritual healing to their work. They have done the work themselves. They continue to do the work. They are not fallible. And so this is more of a deep understanding and a lifestyle and a practice. So if the provider doesn't have a connection to the work, or they don't practice it daily, again, they're not really a holistic provider. They may just be, a naturally minded or an open, somebody who's still learning or that kind of thing. But, we want to reserve, what it actually is. And so systemic challenges, right? So there are so many challenges finding, like I feel like a unicorn. I really do. I say that, with love, I'm not, but in this context, sadly, there are not enough holistic providers to service the amount of patients that are needed because the system is failing so many people quite literally as I speak. But there's not enough providers, to really serve. So, and there's tons of misinformation and miseducation. People thinking that primary care doctors have the system, the space, the education, the understanding, the connection to deliver on holistic care. Instead, they're looking for, a quick supplement person. And so that was the last thing that I wanted to bring up is about type of care. So we talk about you have to have all these things, these connections to be a holistic provider. There's not enough holistic providers, right? So then what happens to a vulnerable patient population? A lot of times they get hooked up with providers who, again, market themselves as holistic providers who maybe are good intended, right? But there may be functional medicine providers or naturally leaning providers or integrative medicine providers or, primary or allopathic doctors that are now dabbling in, like they're trying out supplements. Like there's that going on too. If your provider is not running labs and then giving you supplements based off of your labs, run for the hills, because promoting more supplements isn't gonna help. But we do need more specialized providers. We need people that are more trained in not just the supplement thing and the lab testing thing, but really trained in walking people through a process of healing. Now, they're probably going to have to abandon their conventional model. They're going to have to get more creative, meaning, and I built a model that's very sustainable, that supports the provider as well as the patient so that the patient gets the care and the care level that they need. But you have to step out of the conventional system, get out of the reaction, get more into the proactive nature, get more into an embodiment, a holistic practice, right? And so even providers who want to be holistic, wow, you guys are jumping in already, who want to be holistic providers, start doing the work with yourself, start practicing yourself, start really embodying this yourself, because if you don't, begin that process, you're really going to have a disconnect and do, a disservice. So hopefully that clears up why primary cares can't be a holistic provider to you unless they have done the work and they've left the system. Sadly, they you cannot be a holistic provider still taking insurance. It just will not. It cannot sustain. So I know you guys really want to use your insurance for holistic healthcare. It's not designed for that. It's not made for that. And so this is about investing in your health. This is about investing in, your long-term health. You invest in everything else. Why not your health? So if you're interested, you can book a discovery call below, and definitely check out all the rest of my content and like, share, subscribe for more.